Heading into the holidays, are you looking forward to indulging in some homemade treats? Well, for those with chronic conditions like diabetes, that extra sugar around the holidays can make it challenging to manage their condition. During National Diabetes Awareness Month, I'm here with Dr. Kambelos, Buckeye Health Plan's Medical Director, to talk about some of the ways you can manage diabetes heading into the holidays, starting with what you eat. And Dr. Kambelos, thank you for being here with us today. I know that diabetes is certainly challenging for many Ohioans. How common of a diagnosis is that?
Well, first, I'm glad to be with you again, and it's very common. So 1 in 3 Ohioans is known to be an established diabetic. Unfortunately, there are over 250,000 of Ohioans who have no idea they're diabetic but are. And then 1 out of 10 are actually pre-diabetic, which is a precursor condition to diabetes. So slightly elevated blood sugar, but not quite diabetic range.
And so that's a big question here is what exactly is diabetes and how is it diagnosed?
Diabetes is a problem where our bodies have problems metabolizing blood sugar. And diabetes itself is a condition where there's either not enough insulin being made by our bodies and or where our bodies become insensitive to our own insulin. And there are a couple of different types of diabetes. There's type 1, which is typically autoimmune, type 2, which is also known as adult onset, the most common, 90% plus, and then gestational, which is involves pregnant women.
So certainly this diagnosis can be challenging for someone, but once they have it, how does it affect your life?
Gosh, diabetes is a common denominator illness to many serious health problems. There's an increased risk of stroke, heart attack, vascular problems in general, retinopathy, eye damage, damage to the kidneys resulting in end-stage kidney disease, certainly vascular problems leading to loss of limb. But it's a very serious illness, and of course, the healthcare costs of being diabetic are tremendous, particularly if uncontrolled.
Yeah, so for those who are watching right now, how can Ohioans manage and even prevent diabetes?
Ideally, stay active, keep your weight under control. Naturally watching the starches in our diet, so eating fewer carbohydrates, bread, potatoes, pasta, sweets, alcohol, sweetened fruit drinks, Cokes, soda pop, and eating more fruits, more vegetables, again, keeping weight under control, and following your doctor's advice when it comes to medications, treatments, and follow-ups.
So speaking of food, I mean, how does what you eat impact your health, especially for people who live with diabetes?
Well, we are what we eat, right? So those of us who overindulge in carbohydrates do have a tendency to become diabetic. So once again, limiting those kinds of starchy foods is pretty central to managing diabetes.
All right, so as we head into the holiday season, what advice do you have for folks who maybe are living with diabetes to have a relatively stress-free time around the dinner table?
Hard to avoid stress during the holidays, but when being tempted with all those goodies with which we're going to be confronted, smaller portions. Instead of having a quarter of the pie, have a sliver of pie. Rather than a slab of cake, have a small piece of cake. Smaller portions, especially when it comes to starchy food, drinking plenty of water, staying hydrated, eating regularly, and staying active.
So what is Buckeye doing to help members with diabetes manage their conditions?
So we have care and case managers that are always available to our members to provide them with good healthy tips, healthy living tips, healthy diabetes management tips. We reach out to our members regularly, especially when they're higher risk, like being diabetic, via various channels, email, text, social media, phone calls. We have, again, our case managers, care managers can assist with transportation to medical appointments, and we can certainly assist in facilitation of care. Plus, we provide rewards dollars to our members for getting their regularly needed diabetic care and for their annual well checks. And as you heard me mention earlier, certainly we provide a $25 bonus for those of our members who get the flu vaccine.
All right, a lot of great information here. Yes. Dr. Kambelos, thanks again for being with us. And for you at home, if you want some more diabetes tips, you can visit BuckeyeHealthPlan.com/diabetes.